You are live. Click go live there.
Clicking. I did. Okay.
There you go. Okay.
Now what do?
Let's open the comments.
Am I on all the platforms right now at once?
Yeah, you are. Nobody's on just yet, it seems. Let me open Instagram, see if you're live on Instagram.
Hello. Hello. Wow. It's a little delayed there.
It is. And I don't see you live here.
I have 3 viewers. Hi, Tamara Smith. I have 11 viewers. It's really going to all the platforms at once?
Yeah.
Even TikTok?
Not TikTok.
Oh, not TikTok. But even like it's going to all the other ones too?
Give me a second.
Hello. Do I regret anything during Jackie's surgery? I didn't do Jackie's surgery. So I'm not sure what I would regret since it wasn't me. I assume you mean Jackie O. I didn't do her surgery. So somebody else. You want a mommy makeover? Okay.
We're gonna go live here on TikTok.
On TikTok. We can go live there on TikTok. Okay, we're gonna try and do this. We're trying to do this StreamYard thing. Now, if I'm streaming here, right? Oh, it's weird. It's like it's got that like reverse camera thing. You can, is this, yeah, it's like reversed camera. So that's kind of cool, actually. Hello. Oh shoot. So the number one surgery people ask for lately is mommy makeovers and rhinoplasties. Hello. Can I get another one and put it next to each other? I think there's another one somewhere. I think it might be downstairs by the scrub sink. Hello. Hello, Jordan. Hello, little sack. Okay. Hold on. How do I turn off my notifications so it doesn't keep bothering me? Is there a way to turn that off? Do not disturb or something?
Yeah, let's put your phone on do not disturb, see what happens. Go here.
Yeah.
Let's see what happens.
Oh, hopefully that works. Okay.
Yeah, you're live on Instagram.
I'm live on Instagram. Let me see. How far delayed is it? Oh yeah, I don't see the. I don't see the comment. Oh, the can't turn comments are there.
Right.
Oh, there's 273. That's Instagram. 273 people there, and
it's
then
slightly
100
delayed.
Slightly delayed.
But not too bad. Look, you can still answer questions. If anything, that's a
super
benefit.
All right, great. All right, super. Yeah, if anything, that's a benefit to me. You're right. Hi, Houston. All right, so you okay, but the thing is, if I'm gonna,
you're getting overwhelmed.
I'm getting overwhelmed by all the. Sule papi. Hi, Mona Lisa. All right, so what I want to do is we're trying this like StreamYard thing where we're streaming on all the platforms at once.
Right.
Trying to answer questions. All right. Thank you, Ashley. She's 4 weeks post-op, and thank you. I'm married. I'm married, and I have 5 children and 2 grandchildren. All right. Can you perform a tummy tuck on somebody that has scoliosis in the lumbar area? Yes. And a history of epilepsy. As long as your neurologist gives you permission to have the surgery, then yes, you can. It's no big deal. Can I fix you? Probably. Thank you, Jamisha. All right. Question: can I get a mommy makeover at a blood clot caused by the IV? Yes, that's not a problem. A blood clot. If you have a blood clot in your past, but it was caused by a specific thing like an IV, then that's fine. You can certainly have surgery. Can you get lipo done more than once? Yes, you can. Yes, there are lots of good surgeons on the West Coast. Breast fat with a lift. Yeah, you can do a lift, a breast lift, and with a fat transfer also at the same time. Oh, we're gonna get another stand here. Hold on. Bear with me. All right. Are we gonna go live with people too, or no?
Maybe not this time.
Maybe not this time. We can always experiment in the future. All right, hold on. I'm putting all these cameras together. I can fix anything. All right, I can try anyway. Oh, cancel that. What happened there? Hold on. What happened there? All right, now I'm back. All right, here we go. All right, I got all these. All right, here we go. I got this, this, and this. This is just really two there. And then I can see how I recovered from Mexico. I was in Bogota, Colombia. Hey, Germany, what's up? Does loose skin on arms retract after lipo? You're 5 weeks post-op. So the answer is that loose skin on the arms after lipo uh, sometimes retracts and sometimes no. If you have loose skin before, it's probably going to stay loose after. What I recommend is that you add J plasma at the time of liposuction. That helps a little bit. And if that's not enough, then we do a brachioplasty. We actually cut the skin out, leaves a little scar along the back of the arm. All right. So the a mommy makeover. What's a mommy makeover? That basically, mommy makeover is just a general term, which means any surgery that you do to reverse the effects of having kids. So that could be a tummy tuck, that could be a breast lift and a tummy tuck combination. It could be a breast lift, tummy tuck, lipo the back. Could be breast lift, tummy tuck, lipo the back, Brazilian butt lift, thigh lift, all the above. Oh, put me on a timer. Okay, super duper. Cost of a tummy tuck is, I think it's like almost $11,000, 10,000 and change. Have I done any surgeries for a hump on the back of the neck? Yes. We call that, I mean, it's a terrible name, but the technical name for it is called a buffalo hump. So that like fatty lump on the back of the neck here is called the buffalo hump. And we just liposuction it down. I probably have a date or two available in October. Angela from Medellin. Do we use ultrasound for BBL? Yes. I do use the ultrasound for the BBL every single time. Let's see, other questions. BBL and nose job at the same time. Yes, I've done BBL and nose jobs at the same time. Obviously, you have to use a bobby pillow, and which is fine. And you have to sleep with your head elevated, which is also fine. I'm retiring in 8 years. This is I just had a birthday, so I have this calendar, and I peel off every month or so down to my retirement. Someone gave it to me years ago, and I've been using it, so got to have an end date, right? Botox or fillers for dark circles. Sometimes they work. It depends what causes the dark circle. So the dark circles can be caused by three things. Basically, you can have thin skin like me with blood vessels close to the surface of the skin, and those blood vessels are just under the surface there. I really can't do much about that. Sometimes you'll have circles here because there's fat here kind of bulging out, and it creates a little shadow. And then the third reason could be that you have melanocytes, like skin cells that tan darker with exposure to the sun, and that can cause it. So those three things. If it's the fat here, then you can have that removed surgically. If you have the fat here and you have like a trough there, you can inject some filler into the trough, and that gets rid of the shadow. Or if it's the darker actual melanocytes there, you can lighten it with different lasers, different light treatments, or even just bleaching cream, like Triluma or hydroquinone. What BMI do I recommend before getting a BBL? So the answer is it depends. There's no like hard and fast rules on it. So depends where your fat is. The BMI just means a body mass index. It's a relationship of your weight to your height. So if you have fat in the right places, right? For example, in your tummy and your love handles, your lower back, even if your BMI is kind of low, if you have enough fat there, you can move that and make a difference. Now, if your BMI is high on the other end of the spectrum, let's say it's a 34 or 35, it becomes more of a health risk as your BMI gets higher. So ideally, you want to be somewhere between like 22, let's say on the low end, and 32 on the high end of BMI. How does lipo work? How many spots are treated with one round of lipo? So you can pretty much treat the entire body with lipo at one time if you want to. It just adds to the cost and to the time and to the pain of the recovery. But there's no limit in terms of the number of areas that you can get liposuction at one time. All right. My wife wants to have a BBL with lipo, but she had a small blood clot 3 years ago. Define small blood clot, Ahmed. I don't, in general, if you had a DVT, a blood clot in the legs, I don't recommend that you have any elective surgeries lasting more than an hour. Do you lose feeling in your nipples when you get a breast augmentation? The answer is usually not. Like, not vast majority of women have the same sensation in their nipples after breast augmentation or breast lift than they did before. Now, in the immediate post-op period, you could have more sensation, which is actually pretty common, where the nipples are just like super sensitive, like you can't even like even your clothes touching them makes them sensitive, or a little less sensitive, and then it tends to come back over time to where it was before. On the other hand, it is possible to lose sensation, although it's rare to lose it in both nipples at the same time. How old am I? I'm 52 years old. Again, the lowest weight for a BBL, someone keeps asking that, it's not about the exact BMI, it's about where the fat is. So I've had patients with a BMI that you'd think would be heavy enough to have a BBL, but the fat's in the wrong place. If your fat's in your breasts or in your butt already, doesn't help. But if it's in your love handles or your tummy, we can get to it, your arms, then that's fine. Do I recommend a gastric bypass for somebody who's 22? The answer is how much weight you need to lose or not. I recommend everybody start for their weight loss journey starts with one of the GLP-1 shots. So either semaglutide or tirzepatide, the Mounjaro, Wegovy, Ozempic, Zepbound. Start with that for weight loss first. See how far you get with that. When you plateau with that, you can't go any further, then think about gastric sleeve and or gastric bypass. I've had patients that have lost more than 100 pounds just using the medications in the last year, just using Ozempic and Wegovy, etc. Are you able to tell if someone will possibly regret having surgery? Yeah, you know, sometimes I can. You know, what I do, what all plastic surgery is essentially psychiatry with a knife. Okay. What I do is to make you feel better about yourself, about your self-esteem, so that you feel better in your own body, you know? And I know what that feels like. I mean, I've had plastic surgery. So I know the feeling of being self-conscious about your nose or your chin or your whatever, love handles, whatever it is. So if your expectations are realistic, right? It's not like a magic wand, you know? Although sometimes it does look like magic. It's not a magic wand. It doesn't solve all your problems. It just solves the one specific problem that you asked to be fixed. Your breasts are low, we can make them high. Your breasts are small, we can make them big. You still have to work, still have to pay your mortgage, still have to take care of your kids, all the other stuff. So again, if your expectations are that it's going to change your life and, you know, make that guy from high school call you, I don't think that's going to work. So you'll be disappointed. But if your expectations are realistic, and by realistic, I mean, if you can find a before picture, a before and after set of pictures somewhere online with someone with your similar body, and you see their after picture and it looks like what you're going for, then your expectations are realistic. You know, not every body can be just like, it's not like, you know, Mr. Potato Head, right? Just take off your ear and pop on someone else's ear, your head and onto your bone structure is kind of what it is. And we can work with that. And your skin type is what it is, if it's thick or thin, etc. So find somebody with that, your similar attributes, and see if their after pictures match what you're thinking of. So that was a very long answer to a short question, which was, can I tell if somebody's going to be happy with their results? And again, it depends on what they're thinking. So it's important that I talk to them and that they express their expectations to me honestly, and then we can have the conversation. Rather you not have surgery if your expectations are not realistic. Okay. Hello, Nicaragua. Let's see. Looking to book a consult, but the recovery scares you. I mean, the recovery should scare you. I mean, it's a big deal. There's a reason I call our plastic surgery patients beauty warriors. I mean, it is a battle. It is a battle. The first couple of days after like a BBL tummy tuck combo, it's rough. The first 3 days. By 1 week, the pain goes down. It's like on a scale from 1 to 10, it's like a 7 for the first 3 days, and then it's like a 4 or 5 by 1 week, maybe like a 3. Okay. Thank you. I did have a good vacation and a good birthday. Thank you very much. All right. More questions. No, I've never had a patient pass away due to a complication. I've never had any patients die in my practice, thank God. And it's more than 20 years. It's like 21 years in practice. No one's ever died, thank God. very paranoid about that. Keep all my patients safe. As much. I'm printing on bichectomy. I don't know. Does Bella? Yeah, Bella still works here. Yeah. We've been off on vacation, so I mean, I'm like the only one in the office. There's a couple of people in the office, but that's it. We're not. I'm going back to surgery next week. This is still kind of like an off day. Diabetics. I don't think diabetics should have any elective cosmetic surgery. It's my opinion. There are surgeons that feel differently. I worry about infections and wound healing issues in diabetics. Now, I should qualify that. Just being a diabetic doesn't mean you can't have elective surgery. As long as your blood sugar is super well controlled, and your hemoglobin A1C, and if you're diabetic, you know what that number is, should be lower than, let's say, 5.7. That'd be good if you want to have. But if you have diabetes, your blood sugar's out of control, and your hemoglobin A1C is like an 8, do not have surgery. You're playing with your life. Multiple C-sections, you probably need a tummy tuck, not lipo. Am I a real doctor? I'm a real doctor. I had my hip disc filled with fat. It dropped. That happens. Sometimes the fat, gravity will bring the fat down a little bit. The only way to fix that is to suck the fat from where it fell to, move it back up. Please make TikToks with Finita. I will. I think Finita's coming in next week. She's gonna have you've been following her weight loss journey? I hope so. All right. All right, let's see. Is there a risk with plastic surgery if you have high Arizona, if you have low blood pressure? No, low blood pressure is usually not a problem at all, actually. Am I the doctor from the Reddit story? Rosie, can I answer that question? Am I the doctor from the Reddit story? I'm not the doctor from the Reddit story. Okay.
You're definitely not the doctor from
I'm definitely not the doctor from the Reddit story. Is that clear?
Yeah.
I want to get that as a sound. You can put that on as a TikTok.
Yeah.
I'm definitely not the doctor from the Reddit story.
Right.
Is that clear everything up? Would I do surgery on an MS patient? Yes, I have done surgery on MS patients. Not the voice you were expecting, huh? Well, that's okay. Should it be deeper? Should it be deeper? Would you like my voice to be deeper? You always thought I had like a German accent. I can do a German accent. I have worked with PCOS girls, yes. Youngest age I will take is 18, unless with your parents' consent, it's something more like a reconstructive thing or a nose job. I will do a nose job on a 16-year-old girl, as long as you've finished growing, you've went through puberty, and you're pretty much reached your adult size of your face. I will also do breast reductions on girls that are as young as 14 or 15, because why should they go through high school, with the extra weight and, everything that goes with that. Thank you very much. Do I do skin removal? Yes, I do skin removal. Okay, low iron patient risk. That's a good question. So A1C below 7. I would prefer it be below A1C below 6, actually. Okay, what was the question? Gosh, I had a question there. What was the gosh? There was a question. Was it PCOS? Am I in my flop era? Very possibly. Very possibly. I hope not, but hey, them's the breaks. Yes, liposuction can be done through an appendectomy scar. If you have blood clot, low iron. Now is the question, Alicia. Thank you. Low iron. Okay, so here's the thing. When you say low iron, that usually means you're anemic. That means your hemoglobin is 10 or less than 10. When you have, for example, a BBL or a tummy tuck or any serious operation, a breast lift, you want your hemoglobin as high as possible, at least at 11 or 12. Now, if not, if it's, let's say, below 10, you can do the surgery, but you have to have blood available for transfusion, because if your blood count, you're coming in with a 9 or an 8 and you go into elective surgery, you're going to end up being like a 6 or a 7 after surgery. You're going to be really anemic, really weak. Your heart's going to be beating fast. If you have any heart issues at all, it'll start to show up. So I like to keep my patients nice and
what's the word? Non-anemic. You know, I'd like their hemoglobin levels super high. I have a blood bank, and so I have patients. All my patients, when they go in for big operations, have 2 units of packed cells waiting for them. I also have a machine that gives you back your own blood called a cell saver. So that works really well too. Okay. Yeah. After gastric sleeve, when you can get a BBL or breast implants. After gastric sleeve, I would wait until you reach your goal weight and you're stable for a few months before you think about any of the skin removal surgeries or the BBLs and stuff like that, or even breast lift. Because what you don't want to do. Hi, Costa Rica. What you don't want to do is have the surgeries and then lose another 50 pounds and then everything, you need more surgery. Yeah, we checked their hemoglobin right before surgery. Your hemoglobin 6.8, Kenzie. I would get that looked at, and I would start taking iron every day. So if you're prone to keloids, good question. If I'm prone to keloids, what should I do for surgery? So keloids is fairly mysterious. As you know, a lot of patients will have a keloid one place in their body. Let's say they'll pierce both ears. One will keloid and one won't. Or even in patients that are prone to keloids, I'll have like a long tummy tuck incision, and like 80% will be fine and 20% will keloid. So we don't really know all the mechanisms that cause keloids. So if you're prone to it, what we do is we inject Kenalog, we inject a corticosteroid into the incision when we're closing it up, and that decreases the risk. And then we also have tricks like silicone tape, pressure tape, things like that to keep it down as it's healing. Hopefully that works well. VSG for metabolic syndrome. Sounds like a good idea. Do I get Botox and filler? I don't get filler, but I do get Botox, but I haven't done it in a few months. So I'm kind of due for my Botox. Am I hiring a first assist? No, but it's always good to send resumes because you never know. People move on in life, other jobs. So you never know. Can a tummy tuck help with core strength? To some degree, yes, because a lot of women, after they have babies, they have a separation of the muscles in the center. You know, the abdominal muscles go up and down the center of your body here, the six-pack muscles. And they are kind of connected in between by this layer of tissue called fascia. And usually the fascia is together like this. So you have these muscles that contract up and down, right? They give you your six-pack. And like the little the fibers that make the outline of the six-pack, that's what fascia is. So it's little attachments. And they connect in the middle. The two abdominal rectus muscles go up and down like this. They connect in the middle. When you're pregnant and your uterus expands and the baby grows, the muscles stretch out, and then this fascial layer, that weak part, separates. And you have what's called the diastasis in between that separation of the muscles. And you can do all the sit-ups you want in the gym, moving the muscles up and down. They'll get stronger and bigger, but they'll never come back together. So what we do in a tummy tuck is once we lift up the skin, we put this real strong suture and bring the muscles together like that. Then once it's healed, you can go back to the gym, and you'll notice that instead of when you do a sit up or contract, instead of having this like bulge in between the muscles, because that weak area where your intestines will kind of push out, it'll be straight, it'll be flat, and so that's how it increases your core strength. So it doesn't like increase your core strength. It just allows the muscles to do their function better. So far, only one of my 4 sons is interested in surgery, and my daughter is not. So, yeah. Okay, let's see. All right, so let's see. What other questions you guys have? Do you do internal corset? Yes, I do an internal corset for the tummy tuck. Oh, good, Jackie. Jackie's 1 year with her beautiful cherries. How long do you have to wear a faja? Is it normal to still have heat, burning pain post-lipo after 3 months? Okay, so I usually recommend the faja for at least the first 6 weeks. People can wear it for 6 months. Some people wear it the whole first year. It is normal after liposuction to have these it shouldn't be like a burning feeling constantly, but you'll have what I would describe as like a lightning shooting pain. And I've had liposuction, so I can speak from first experience. I mean, it's been like 20 years since I had liposuction, but I remember the feeling, okay? Basically it's like you feel this like tearing sensation all of a sudden from random movements, and it's like a little lightning flash of a burn. That feeling is more common during the first couple of weeks after liposuction. It gets less frequent, I should say, over the coming months. So at 3 months, you should maybe have one or two of those little pinch feelings, once a week or something. So if at 3 months you're still having them constant, could be something wrong. When you say you've had blood clots, yeah, if you've had a blood clot in your legs, you shouldn't have elective surgery. We should think very carefully about it. I shouldn't say never, but you should be very careful with that. Yes, I can get rid of a hump behind the neck. We talked about that. Best age for a mini facelift, I would say early 40s for most people. If you want to do your first mini facelift, you do it in your early to mid 40s. I'll tell you what the secret to a lot of Hollywood celebrities looking young so long is that they've all had surgery. Okay, let's just call it how it is. Okay, they pretend, they'll say they haven't, and they never did. They all done something. 99%. But what they do is, yeah. Let me tell you what I mean. What I mean is, okay, you don't have to do your first facelift in your 40s. But someone's asking me, the question was, what's the best time to do your first mini facelift? I think it would be in your 40s. And the reason is, what I was getting to, the secret of Hollywood celebrities is that they don't wait till they're like 65 to have their first facelift. They do these like little mini tucks every 3, 4, 5 years. Just a little, they just keep it. So that's why they kind of look like they're not aging, because every 3, 4 years they do these little tucks. So instead of like one big, wait till they look old and then one big tuck where they look like, these, the ladies from the 80s from Boca Raton, like just like pulled back like they're a wind tunnel, because they waited too long. If you have your first facelift in your 60s, it's going to inevitably look like that. And you're obviously, people are going to know you did something. But if you do it, Joan Rivers, yeah. So if you do it early and you just do a little nip every couple of years, there's a little more skin, a little more skin, a little more skin, you pretty much can stay looking like you're in your mid 40s or till you're like 70. And celebrities that are like 70 and they look like they're in their 50s or 40s, and it's because they just do this little routine of little tucks. Advice for traveling on a plane after a BBL. Yeah. So if you're traveling on a plane after a BBL, definitely take your boppy pillow. I would wear compression socks, and I give everybody SED boots, those like compression boots to wear to prevent blood clots. That's the main thing. And then when the captain turns the seatbelt sign off, just get up, walk up and down the aisle. Just keep the blood circulating. Scar gel creams for scars. I like Biocornium. You get that on Amazon. Botox lasts 3 months, 4 months maybe, and there's a newer version of Botox. It's not by Botox, but it's a version of similar medicine that lasts 6 months. Can a person with fibromyalgia get a tummy tuck? Yes. How long after surgery should you wait for a camouflage tattoo? I would wait probably at least 3 months. Probably 5 or 6 is better. Yes, I have done breast augmentation on pectus carinatum. Yeah, I have done that. Biocornium was the name of the gel. What exactly do you recommend for diastasis recti? There's nothing but surgery. I mean, some people will try that, like, what's that machine called? That M-Sculpt? Or like, it's like this like electricity thing that you like put on your stomach, and they brought the machine to my office for me to try it out once. So painful. I couldn't last more than 5 minutes with that thing. It's like the equivalent of like 1,000 sit-ups, but it hurts. And I might as well just do sit-ups. But okay. Yes, I've done a bunch of redos on people that had surgery in Mexico. It's true. Surgery options for cellulite. The only surgical option that is worth anything is called Avali, which is basically like a long, fancy scissors that we put through a little hole and we snip the little bands causing the cellulite. Avali. How do you spell Avali, Rosie? Aveli. Yeah, I do revision rhinoplasties. If you're interested, just go to my whatever link thing and make an appointment. How effective are breast fat transfers? So they're okay. So here's the thing: you can make your breast bigger with implants. That's the usual way to do it. Good old fashioned silicone implants. They work great. Been around forever, and they're good. The smallest implant I've ever put in is like 150 cc's. Smallest implant I've ever put in. Most people, when they get their breast made bigger, augmented, it's going to be like 350, 400 cc's, 800 cc's. This one in my hand here is 340 cc's. That's about average size. Now, when you do a fat transfer to the breast, you're looking at maybe 150 cc's max surviving each time you do it. And you can do it multiple times. So you can build up to get about, 200, 250. But you can't go from like an A cup to a D cup with fat transfer, in my experience. You can go from like an A to a B, or a B to a C, or a B to a B plus. It's like kind of like 150 is like half of this, like a push-up bra worth of fat will survive. Now obviously, if you gain weight, the fat cells are good, like they're a little bit bigger. But again, it's much better. It's definitely much better to have implants if you really want to be bigger. So there we go. Have you ever rejected patients due to health concerns? Yes, of course I have. Many, many times. Talk about reductions. Breast reductions? I can talk about breast reductions. So breast reductions can be done in one of 3 ways, basically 3 or 4 ways. The most common way in 90% of breast reductions are done this way. We make an incision around the areola, down the middle, and underneath the breast. And basically, we move the nipple up to where it belongs. It stays attached to your body in most cases, okay? And so the ducts and the glands and the nerves that attach to the nipple are all intact. So you still have sensation, you would still be able to breastfeed in the future, and so forth. And then we tailor the rest of the skin that's sagging out. We basically tailor tack it and then cut out the extra, and then sew it back up. So once that's done, you have a scar around the areola, down the middle, and underneath the breast. Very simple. Now, that's the most common way of doing a breast reduction. Now, some people, if the nipple is not that low, if it's not gone below the fold of the breast here, you can get away with just doing an incision around the areola. And that lifts up about 1.5 centimeters. And if you do that, plus put an implant in to fill out the extra skin, you can get away with that. Occasionally, some people can do a lift or reduction with just an incision around the areola and one down the middle. And I would say, I guess there's 4 ways. The last way, maybe 5. The last way would be if the nipples are really, really low. I'm talking 40 centimeters from this point here. If you measure from here all the way down, your nipple is like 40 centimeters or more. Then we actually take the nipples off and transplant them. In those cases, you won't have sensation in your nipple afterwards, and you won't be able to breastfeed. So that's the downside of that. But you'll have smaller breasts, and you can reshape everything. And the last way I should mention, because it's very rarely done, but you can do liposuction of the breast too. And if the skin is tight and they're just a little bit saggy, you can do liposuction and do that as a way to do it. All right. So I don't do paniculectomies. I think paniculectomy is a terrible operation, and I would only ever do tummy tuck. Paniculectomy basically it's like a cop-out operation, in my opinion, for insurance companies that don't want to pay for tummy tucks after weight loss. That's my opinion. Okay, let's see. Other questions? You're also a plastic surgeon. Cool. Good to know. Yeah. Okay, if you have capsular contracture, how do you detect what's capsular contracture? So capsular contracture is when scar tissue builds up around the implant. So when you put a breast implant in, your body automatically makes scar tissue around it. So the normal process that happens anytime you put a foreign material into your body, including like a artificial, like a knee replacement or hip replacement or anything at all, cord cath or something. Whenever you have a foreign material in your body recognizes it as foreign and builds this fibrous wall of scar tissue around it. Perfectly normal. Now, in most cases, when you put an implant in, that fibrous capsule around it is soft. I mean, it's a little bit thicker than your normal tissue, but it's soft. And it should be wider than the actual implant itself. And that's why we ask people to massage the implants, massage the breast when they have implants, to kind of move that pocket around so that breast implant has more space in that capsule, in that fibrous scar area where it's sitting. So it moves naturally. When you move, it goes to the side a little bit. In some people, the body's immune response to the implants, it's not a rejection. It's not like you're rejecting a kidney or something like that and it's going to spit it out. But sometimes the immune response, the immune response to the immune response to the implant will cause that capsular tissue to calcify or contract. It just gets harder and harder and constricts around the implant. That's called a capsular contracture. When that happens, you'll notice that that breast will be harder than the other breast. It'll be firmer. It may sometimes can also be tender. It can get to the point of being a little bit painful when you lean on it or move around. And there's a few grades of capsular contracture. So there's, because mild contracture might not even notice, but then serious, severe contracture, not only is it hard and feels kind of like a rock, the implant can go right up, it can be painful, and you can actually see it deforming on the skin from that. When you have a capsular contracture, you do need more surgery to remove that scar tissue and put in a new implant. The good news is most of the implant companies have a built-in warranty or an additional warranty you can buy that pays to have the implant replaced and have the scar tissue removed if it happens. And the newer implants have a lower capsular contracture rate than the older implants did. Okay, if you have extremely hollow eyes, yeah, you should start with filler. Try it. Advice on implants for very small-chested women. Yeah, I mean, I would start with how big do you want to be? There really isn't a limit. People think, can you get those implants in? You can pretty much put any size implant in any person. Will it look great? If it doesn't really match your body's proportions, maybe not. But you just decide how big you want to be, and then we can put whatever size implant you want and get you up to that cup size. I always recommend that when women come in for breast implants, that they bring pictures of breasts that they like so that we can both be on the same page. Because some people will make the mistake of saying, I want exactly 225 cc implants because my friend had 225 cc implants. You really can't compare person to person unless you happen to have the same exact body size and structure as she did before her surgery. So, for example, if a woman has full C cups, right, to begin with, and you put in a 200 cc implant, she will get up to being a full D. But if a woman comes in with A cups and you put that same 250 cc implant in, she's not going to get up to a D. She'll only be up to a full B. So again, don't come in. It's better not to come in with a specific number. Better to come in with a picture of what you want and then have the surgeon guide you. I'm not going to the F1 race as of now. Why does the belly button look weird? So yeah, the belly button can look weird after tummy tucks sometimes. Every surgeon has their own technique for belly. Not every surgeon has their own technique, but there's a few different techniques. I like a belly button that hoods a little bit, so it hides the scar. Some surgeons don't do that. You can see the scar all the way around, and doesn't look to me that doesn't look natural. If revision rhinoplasty left too much scar tissue, yes, you still try steroid shots even 3 years out. Steroid shots work no matter how far out you are. Be careful with steroid shots in the nose or really anywhere because they're somewhat unpredictable. So, go slow, go a small amount just in the beginning. Ozempic, yeah, I just said before, I'm a big fan of Ozempic. Super fan of Ozempic, and if you want to get Ozempic, you want to get Wegovy, Mounjaro, Zepbound, semaglutide, etc., I recommend a company called Kiini Life, KIINILIFE, KiiniLife.com, KIINILIFE.com. That's why I'm a big fan of the semaglutides. Big fan. I think they're amazing. Yeah, I'm a big fan of Ozempic, Wegovy, Mounjaro. I think they're life changing for many patients. Big deal. And even if, yeah, compound semaglutide is great as long as you know the pharmacy you're getting it from and that you know that it's legit. That's all. And that's why if you want compounded, I recommend that company, Kini Life, because I know where they get their stuff from. It's all good. And I have patients take it and they lose weight. It works. So, but there's nothing wrong with compounded semaglutide or tirzepatide as long as it comes from a legitimate source. For hip dips, fat transfer. That's the only thing really that works well for hip dips is fat transfer, BBL. What do I think of the flueless IVs? I'm not sure what that means. Can you get rid of the pit? Get rid of the pit. What's the pit? The pit. Can I get rid of the pit under the apron belly so the belly just attaches straight to the food? Yes. Yes, I can do that. Done that many, many times. Many, many times. Get rid of that pit for sure. The website was called Kini Life, KIINILIFE.com. Okay. Filler to slim the nose. I mean, filler is, yes, it can kind of slim the nose if you, but it makes the nose bigger. Just remember, anytime you put filler in the nose, you're making the nose bigger. So if your goal is to have a smaller nose, filler is probably not the way to go. Thank you, Ayad. Can you get? I'm grabbing December. We're gonna get okay. Yeah, I do other people's revisions if need be. No big deal. Stretch marks. I don't have a great answer for stretch marks. Although, Rosie, when's that camouflage tattoo course happening? Oh, I'm doing, me and the girls in the office, we're going to be learning how to do camouflage tattoos for scars and for stretch marks. So I'll let you know how that goes. I've seen some results that look really, really good. It's a little bit of an art to it. So I don't want to promise anything until we actually take the course, and it's a couple of days course that we're taking. Doesn't look that hard, but I'll let you know. But that's a possible solution for some stretch marks and for scars. Where are the free BBLs at? Why don't you tell me? I just gave away 2 surgeries like 3 weeks ago. On birthday, remember? Well, name for Ozempic is semaglutide. That's the name of the compounded version. The company's KiniLife.com. That's right. All right. Embrace the stretch marks. No, you don't have to embrace the stretch marks. If the stretch marks are below the belly button, you can cut them out with tummy tuck. Yeah, I think tirzepatide is better. It's more expensive, but I think it's better than semaglutide. Yes, I've had work done myself. I've had a rhinoplasty. I've had a chin implant, a little lipo. So yeah, thank you. Can I have a mommy makeover and have kids again? Yes, you can have a mommy makeover and have kids again. I've got many patients that have had mommy makeovers. They were like a mommy in their late teens, early 20s, done with that phase of their life, had a mommy makeover, part 2, more kids, and another mommy makeover. Perfectly safe, perfectly fine, assuming you're healthy. And I've even done tummy tucks on the same person, I think 3 times. You know, baby, tummy tuck, another baby, tummy tuck, thought she was done. Another baby, tummy tuck. So I mean, you can have more than one tummy tuck in your life easily. I do a hernia repair at the same time as the tummy tuck. Yeah. Oh, someone asked about awake BBLs. I don't like to do awake BBLs. I'm not saying they're bad. It's just I don't like to do it that way. So how does cellulite work? Cellulite works basically. Cellulite is these little bands of these fibrous bands that attach from in between the septa where the fat is to the skin, and so basically fat bulges out in between those little bands. So if you cut those little bands, right, it releases it, and then it's smoother. Now the bands sometimes want to grow back, so it's it's not a perfect. You don't get perfect results ever with cellulite treatment, but you can make it better. And the treatment that I like for cellulite now is called Avali, which is like basically it's a long stick with like a little scissor at the end. And make a little incision, you put it in, the scissor opens, you cut the little bands, you make sure they're cut, you pull it back out. And it's for specific areas of cellulite, works pretty good. Yeah. I'm always open to new ideas and new trends, but I go very slow and I don't jump into something. I don't want to be the first person into a trend. I'd rather be like second or third, make sure it's safe. And then I go real slow. If I've learned anything after 25 years in the business is that, avoid the hype, see what really works, see what's really safe, and then incorporate that into your practice. Um, uh, let's see, how much is a tummy tuck? I think like 10,000, 11,000, that range. Let's see. Why after most tummy tuck is there still a little pouch? Yeah, okay, that's a great question. Cammy Brown, great question. Why after most tummy tucks is there still a little pouch? The stomach never looks as flat as opposed to a BBL when the stomach usually looks flatter. Okay, now I know what she's talking about. And the answer is pretty simple to explain. When you do a tummy tuck, you're able to liposuction the upper abdomen to some degree, the sides, and you can't liposuction though the skin, the center part of the skin you're lifting up. Remember, we lift up the whole tummy as like an apron, right? And this whole flap of skin. And then we sew the muscles, we bend the table, we take out the extra skin and pull what was here down. When you lift this up, if you liposuction this lower part of that flap, right, the part that's not right above where you're cutting it out, that kills the blood supply to that area. And if you try to put it back down and sew it together, that skin will open up and die. So you can't be super aggressive with the liposuction in the center lower part of the tummy when you do a tummy tuck. So that's why if you are overweight, I use that term loosely, right? When you do a tummy tuck, you will always have a little bit of fat in the lower abdomen, always, 100% guaranteed. Now, if you're skinny and you have a tummy tuck and you don't have a lot of fat up here, you just have a lot of extra skin and stretch marks, you will be flat at the bottom when you do the tummy tuck, okay? I contrast that with the BBL. Even if you're a little bit heavy with the BBL, if the skin is tight, you can be super aggressive with the liposuction, even at the bottom, and that will be super flat. So that's why you'll see some women who've had a BBL looking flatter than women that have a tummy tuck. But the difference is the procedure, how the procedure is done, and what they started with to begin with. It's not advised to do a BBL without a tummy tuck if the skin in the lower abdomen here is loose or you have a lot of stretch marks, because once you take the fat out from underneath the skin, that skin is still there. It's going to be loosey-goosey. You're still going to have stretch marks. So again, if that was confusing, I can answer it. I'll think of a different way to answer it, but you had 2 rhinoplasties and your septum is still crooked, deviated. Yeah, I mean, sometimes the septum has a little bit of a memory. If you really don't want a crooked septum at all, you do another septoplasty and then tell them to remove the center part completely, and then sew what's left, the L strut, to the center here, and it'll be straight. At least it won't be curved anymore because they'll just take out the main part of it. You can do a mommy makeover and a BBL at the same time. Yep, absolutely. Is there a weight limit for mommy makeover? There's no weight limit per se, but for safety purposes, I would say definitely under 35 BMI. Don't want to be over 35 BMI. Okay. My rhinoplasties run around $10,000. That's for the bridge reduction and the septoplasty and making it look better on the inside and the outside. How long after gastric bypass can you get a tummy tuck? Again, like I said before, you want to wait till you've reached your goal weight and you're stable. Fleur-de-lis tummy tuck. A fleur-de-lis tummy tuck is like a tummy tuck where usually a tummy tuck, right? We make an incision like low in the bikini line from hip to hip, right? Goes in the bikini line. But if you have a lot of weight loss and a lot of extra skin, and you'll know if you need the fleur-de-lis based on how much extra, like, you only have a roll down here, but there may be like extra rolls up here and a lot of laxity in this direction, not just up and down, but also side to side. So to fix that, we make a fleur-de-lis tummy tuck, which is basically an incision like this and another incision up and down the middle. Okay, so that it's called a fleur-de-lis because the pattern that we cut out looks like a fleur-de-lis, which is that thing they use in Quebec, on their flags there. Yeah. Insurance does not cover rhinoplasty. It can cover septoplasty sometimes, but I don't take insurance. You can get a surgical BBL after a liquid BBL but really only if you don't use permanent liquid BBL. Like if you use a filler that's temporary. I don't recommend injecting fat into areas that already have silicone there unless the silicone's been removed, or any other. Does laser help with stretch marks? Not really, no. Have you seen any tummy tuck with muscle repair hold after pregnancy? Yes. Okay, that's a good question. So I've had, here's what I will say. I've had lots and lots of patients, hundreds of patients over the years that have had tummy tucks and then have kids afterwards. I would say 50% of the patients that have babies after a tummy tuck need another tummy tuck, but 50% don't. And I think I know the reason why. I think that the skin, the skin of the upper abdomen has a different, let's say, genetic component consistency than the skin of the lower abdomen. I think the skin of the lower abdomen, the skin that's below your belly button, I think is designed, so to speak, to stretch. And so it does so easily to make stretch marks, etc. When you do a tummy tuck, you remove that lower skin and the upper skin gets pulled down. Now it's pretending to be lower abdominal skin. I think it's much less prone to stretch marks than the skin that was on the bottom to begin with. That's why I think only half the people who have babies after tummy tucks need another tummy tuck. Even sometimes the diastasis holds. Sometimes. Let's see. What's imaging? BBL and Lipo 360. So Lipo 360 is just the liposuction part of the BBL. Every BBL includes Lipo 360. It's just you do the Lipo 360, and then instead of throwing out the fat, you use that fat to inject it into the butt. So the Lipo 360 is included in the BBL. Got that? All right, cool. Yeah, I'm at 0 now. I've got to end this live. Thank you very much for watching. Thanks for following me on Instagram, on TikTok, on Telegram, which I think is cool, and on, I guess, Facebook. What else am I on live here? TikTok, Instagram, Snapchat, wherever I'm on. Thank you for following me. And if you have any questions, you can always click the link in my bio, make an appointment. It's actually me. I just pick up this phone and we talk. We do a little FaceTime consultation. I do FaceTime consultations with all my patients to make sure that you can see me, I can see you, and give you my number. We can answer any questions you have before the surgery or after the surgery. I've got a great setup here. The hotel, you can't see it behind me, but this is the neighborhood I live in. It's super safe. If you come from out of town, you just land at the airport, either MIA or FLL. You Uber to the hotel down the block. I got a whole floor there with nurses there 24/7 to watch you. They bathe you, massage you, baby you. They're like new parents for you. They're like pretend parents for the week. I visit you there post-op. It's super nice. If you have a tummy tuck, I need you here for about 8 days. If you have BBL, I need you here for at least 5. If you have a rhinoplasty, I need you here for a week so I can take the stitches out and the splint off. Mommy makeovers, people stay generally 10 to 14 days. It's a super safe neighborhood. Everything's walking distance. We take you back and forth. Got a little Dr. Miami van and stuff. So if you're interested in that, just go up and click the link in the bio. We'll see you there. Have a great weekend, everybody. How do I end this?
Okay. We're gonna click here.
We're gonna click
Click
here.
that. There.
Click here. Oh, I could go for days.
All right. There. And then we're gonna end it here.